Laureyns, who is very enthusiastic and hardworking on safe listening. And he's connecting today here from Belgium, right?
That's correct, yes.
Great. Let's hear on actions and facts on safe listening.
Thank you so much for the kind introduction, and thank you so much for organizing this wonderful event. The more we talk about activities on safe listening, the more happy we are, because you will see that's one of the goals of our work group today. So want to state that, in fact, it's our commitment with the WHO World Hearing Forum and the Make Listening Safe work group that we are committed to prevent sound and noise-induced hearing problems. And you see, on purpose, we used problems and not hearing loss, because hearing loss, it's too much reflected to the audiogram only, but hearing problems are multiple aspects. Of course, it's also audiometric hearing loss, but it's also tinnitus, it's also central auditory processing disorders, it's also a lot of other aspects of hearing functionality that matter to us that can be in danger because of unsafe listening. Now, what does WHO do for make listening safe? There's a lot of activities out there. On the one hand, we have the Make Listening Safe initiative that has been already running for lots of years. It's an expert group that is joining forces at WHO, experts from different fields, but with all related to hearing and ear and hearing care. And they focus on non-occupational or leisure aspects of safe listening. Now, don't misunderstand it. We think that other aspects of safe listening are also very important, but this aspect was very rarely regulated, and it had a lot of very little attention compared to other aspects of noise exposure and safe listening. Next to that, we have the Make Listening Safe work group, which is part of the World Hearing Forum. Amarilis Melendez and me are running this. We are in charge of this work group, and that's a group of stakeholders, and we want to really use communication. So the World Hearing Forum is a whole group of stakeholders related to ear and hearing care. We have about 300 members there, and then we have a specific work group that is really focusing on the communication of safe listening. Because it's not enough to have a wonderful document or a wonderful standard. It needs to be implemented. It needs to be communicated to the people who really need to hear this and need to take action and change behavior. And that is why we have those people on board, also a lot of young people on board. And we're very happy, because I think that this work group is one of the biggest work groups from the World Hearing Forum, because a lot of people are so enthusiastic. And one of the actions we have taken is also that we have created a Make Listening Safe LinkedIn group. So I will share the link later. Hopefully we can put it in the chat. Please come and join us. It's a closed group, but you are very welcome to join us, where we will only post information that has been checked. So we know it's only quality information arriving there, allowing experts to exchange, but also people in the field exchanging information. The latest information is always posted there. So it's a very good platform, and it gives a lot of very positive interactions. Our main goal, and it's kind of blunt, we want to create a world where nobody's hearing is put in danger due to unsafe listening. And you see right away, we said nobody's hearing. We didn't say hearing loss. That is on purpose. And we want to create a world where that is no longer in danger. And it's blunt. We know it's a kind of a challenge, but we want to get there as far as we can. Now, if we say that this work group is focusing on non-occupational or leisure noise, it doesn't mean that we forget all the rest. WHO is actively working on occupational sound and noise exposure. This is one of the examples of a very big document, a large, very quality file on preventing disease through a healthier and safer workplace. And I can assure you that hearing and hearing protection gets a lot of attention in here. Also, environmental sound and noise exposure gets a lot of attention. The European Office of WHO created a wonderful document, Environmental Noise Guidelines for the European region, stating that noise exposure not only has impact on hearing, but has impact on many aspects of life and your health. And that is a great document. We will make sure to share the links. You can find all those documents. And then, of course, as Ayrton already discussed and presented, we also have all the work we have in our Make Listening Safe groups and our Make Listening Safe initiative on non-occupational leisure sound and noise exposure. Now, these all add up, because if you would be doing great on leisure, but you're not doing great on occupational hearing protection, or you are in an environment where there's a lot of noise, yeah, that is not very helpful. You have to know that all of them add up. So that is so important, not to think in silos, but really see that all this matters. Our cochlea doesn't care where the noise is coming from. I think the exposure is exposure, and we need to see it all. The good thing about Europe is that we already have multiple directives and multiple regulations in place. So the European Commission has filed multiple directives. There is one on personal music players. There is one on minimum health and safety requirements regarding exposure of workers to the risk arising from physical agents, and noise is definitely part of that and very prominently present. And there's also a directive on the assessment and management of environmental noise. So you see, there's a lot of things happening. Unfortunately, a lot of this is not really fully implemented and adopted in a lot of European countries. Now, if you look at what they are looking into and what they are proposing, the directive on occupational noise exposure states that there are two levels. One level is a lower exposure action level, and that means 8 hours of exposure to 80 dBA per day. And then you have to make individual hearing protectors available to workers. This states available. So at that moment, you don't need to wear it, but it needs to be available. The moment you have a higher level, which is 85 dBA for 8 hours a day, then you need to, that's called the upper exposure action level value. And then you need to have individual hearing protectors that shall be used. And you need to double check if workers are actually using that. And that's essential. So there's a fairly big difference between those two. When we look on the directive on music players, you see that a 80 dBA exposure time shall be limited to 40 hours per week. So that is no longer per day, but per week. But you see the 80 dBA coming back quite frequently. Now, one of the first standards that we have created together with the International Telecommunications Union, that's also a United Nations group that is working on standards for a lot of very important aspects. You will see there are two versions of this standard. So it's the Safe Listening Devices and Systems standard. One is WHO, which has more beautiful graphs and visuals. The other one is ITU, which is slightly more technical, but the content is exactly the same. The logic in there is that there is a standard safety level where you should limit the sound exposure to 1.6 Pascal square per hour. And that is the same as 80 dBA for 40 hours per week. That's what you have seen before as well. And then we use what we call the equal energy principle. So I don't think I have to explain it to you, but every time you increase the level by 3 dB, you are doubling the energy. So the logic is if you double the energy, you should cut the exposure to half of the time. So 80 dB, 40 hours, 83 dB, 20 hours, 86, 10 hours, 89, 5 hours, and so on. So the more you increase in level, the shorter your exposure should be. What is not always known is that in those standards, we also have a second level, a higher safety level, which is intended for sensitive users like children, people with diabetes, people with tinnitus, people that are much more sensitive to noise and where you want to be careful not to expose them at higher levels. And so the safety level at that moment is lower to be sure that there is no harm. And then it's set to 0.51 Pascal square per hour. That equals 75 dBA for 40 hours per week. So the standard suggests and writes clearly how you have to implement that in different equipment, smartphones, devices, and headphones. You typically will measure your dose on a constant base, and it's a running period. Here you see a period of 7 days. You may have seen it if you open your health app in your smartphone, that you can see how much you have been walking, how many steps you took, but you will also be able to see how is your sound exposure. So that's what you will see if you click here. This is my sound exposure from last week. And there I see I was listening at 68 dBA for 18.5 59 minutes, 80 hours and 15 minutes. So I'm doing okay, I'm getting a good hooray. What you may also not know is that you can also see that on smart watches. So it will also indicate if you're listening too loud, yes or no, and it can also show your the time you have been listening and at which level, which is there, but I think most people don't even know that. And that is one of the reasons that we need to make Listening Safe workgroup and all of you to inform young people that that information is there. Please go and check it. It is very good information that can help you to get better safe listening attitudes and behavior. Now, of course, the promise is we would say more about the WHO Global Standard for Safe Listening Venues and Events, which was just launched at the 3rd of March 2020. It has 6 specific topics it's covering. The first topic is limiting the sound level, and here you see it's 100 dBA measured over 15 minutes, LAQ 15, which is of course much higher than the 80. We'll come back to that. We also need to show, and it's very clear, a good description on how to monitor those sound levels, good information for sound engineers and venue organizers. It also states how to optimize the venue acoustics and sound systems so they are optimized for good sound quality, but also for safe listening. And that makes a huge difference if they are designed like this. Then you have to make personal hearing protection available. And here you see, make it available is not the same thing as using it. And I think you also need to be sure that people are actually using that hearing protection, know why and how to do that. We'll come back to that. What is new, and you don't see that in many regulations, is that they strongly recommend to have quiet zones available so people can give their ears a rest in a quieter zone in the venue at the event. And then last, we also need to provide training, both to the venue staff, but also to the audience, and also propose to really have safe listening events, labeling them as a safe listening event with all the information available and how to practice safe listening there. Now let's go a little more in depth. And for doing this, I want to refer to this wonderful publication. It's open access. Hopefully we can share the link with you as well. It's called Attitudes Towards Safe Listening Measures in Entertainment Venues, results from an international survey among young venue goers. And you see they have an online questionnaire that was filled out by 2,264 individuals, all young venue goers, so they were aged between 16 and 35 years. Most of them were female, so they were the most active in sending, returning the online questionnaire. And the highest percentage came from the African and Western Pacific region, but it was sent out to around the globe and have a fairly good coverage of the world scale. You also see that we have people from WHO who are part of the authors, and also people from the University of Lausanne, really looking at how you can change behavior and how behavior change can occur in healthcare. Really good, interesting study, but we'll refer to it for some specific topics here. So the first feature is you need to keep the sound level below 100 dB LAQ 15 minutes. Now, let me give you some examples on what is already there, what was there in Europe. We have Belgium, in Brussels, Flanders, we have France, we have Switzerland, and they're all around this 100 dB. So Belgium, Brussels, we see 100 dBA, but then for 60 minutes. In Belgium, Flanders, it's 102. France, 102 for 15 minutes, and Switzerland, 100 for 60 minutes. So you see, they're all slightly different, but they come close to the 100. Having a shorter time to average is very practical for enforcement, because if you want to go and check if the level is okay, you only have to measure for 15 minutes. If you have to stay there for 60 minutes, that's a very long time, and then the venue owner will know that somebody's there and may already lower the level. But you see, there's a good balance and there's a good reason why it's there. So this level is already important. Now, should we leave freedom to the venue owners and to the event organizer to set the level as they like, or should we enforce it, and should they not be decided what to do or for them? We asked that, and that was a question in that survey. The question was, should entertainment venues be free to decide at which level to play music? And then you see that Most of the participants stated no, they shouldn't. They disagree completely or somewhat. So 53% is not okay with that, which means that they really insist that regulations are in place and that we set levels to which people should respect. And then how to monitor those sound levels, and that is probably more complex than you might know. Sound engineers are very good at that. So what kind of equipment should you use? Which kind of procedure? What kind of correction should you use? What kind of position? There we had great help from the Audio Engineering Society, who had already created a very good document in May 2020 on how to do that, how to manage that. Those experts joined forces with WHO to write this paragraph of the standard with very practical information, so sound engineers know exactly how to do that, where to put the microphones, where to position everything, and what kind of averaging to take. And then optimizing venue acoustics and sound system design. It's key and essential. They should be designed for sound quality and safe listening. And this will come back because safe listening practices doesn't mean spoiling the fun and not having great sound quality. They should go hand in hand, and that is so essential. So we look at the venue acoustics, room modes, acoustics on the stage area, on the outdoor event, exclusion zones in front of the loudspeaker so people can't get too close to the loudspeaker to keep things safe, and management of on-stage sound. So let me just give you an example. You may have been to a concert, right, where traditionally you had this huge loudspeaker standing in front, a little on ear level, right, blasting through over the whole venue. And then you will see that people standing in front get a lot of sound exposure. So you see the cracking egg, symbol of hurting and damaging your hearing system. But those people standing at the rear, since all those people are in front of them, will have a significantly poorer experience because high frequency don't like to go through the crowd. And on top of that, the overall level will be lower, so they will not be enjoying the music as they should. And that is why a safe listening and quality approach would be to have a different position of those loudspeakers, also take a different type of loudspeakers that are distributing the sound evenly over the whole event space. People in the front don't get overexposure, and people at the rear can keep enjoying good quality sound. And you may have seen these very special loudspeakers at some big concerts, and that's the reason they are there and they are using it correctly. But of course, there's much more to it. It's like how your walls are being organized, how everything is done to make things correct. And then personal hearing protection. It has to be available, it states, right? And then why should we use personal hearing protection? It's kind of simple, since the level is at 100 dBA, averaged over 15 minutes. And you know that a safe level, you should stay under 80 dBA for 40 hours, so the average should be much lower. Then we need those hearing protectors to assure that you get a 20 dB attenuation to be at a safer level. And most hearing protection will be able to do that. So that is why it needs to be there. But does the audience actually use hearing protection or earplugs when they are made available? And I want to show you a study from Eurisco that was published in 2015, but unfortunately we see that things aren't changed. So the question was, if you are in an environment where the sound level is so high, you know it can damage your hearing, are you using hearing protection? And then you see you have different grades. So the winner is New Zealand. So that's very close to Ayrton's region of the world where he's living. Then followed by the Netherlands, Belgium. Australia is a little in the middle. And then the south of Europe is doing quite poorly. Now, being a winner in New Zealand or being in the top 3 in the Netherlands and Belgium, I would wait before I applaud for that, because only between 15 and 13% of the people were actually using hearing protection when they know that their hearing is in danger. Yeah, and of course, here it's dropping even more dramatically. In Italy, not even 6% is using hearing protection. So that gap is something we have to bridge, and it's not enough to have hearing protection available. We also should motivate young people to actually use that hearing protection. And there are ways to do this. Here you see a study by Rick Crutzen from the Netherlands, looking at a special action, the Celebrate Safe approach. It's a training program, an awareness program to inform people better and to make sure that they are using their hearing protection. And you see the impact is amazing. They have an increase of 62%, which is great. And you would think, well, now we are there. But looking at reality, in fact, the number they show here before using that approach is the same as what you saw in the earlier study. It's also 14%. And they increase 62%, but that means they only land at 23% of the audience using hearing protection that is handed out free of charge at the venue. So 77% is still not protecting their ears. That is kind of disappointing. And then if we look in the survey we have used before, one of the statements was, using earplugs does not interfere with my enjoyment of music. And what is the result? 42% says, well, this is not true. So earplugs do interfere with their enjoyment of music, and they go to a concert to enjoy the music. If then the earplugs are spoiling the fun and the enjoyment, yeah, you don't pay a ticket to have a bad quality experience. The other question was, I think that earplugs are uncomfortable. That was the statement. And here you see that most of them state that, no opinion, or most of them say, yes, I agree, they are typically uncomfortable. Now, is this true or not? Is that just an idea? Or is it something we can also evaluate? And that is why we have been running a study at the Thomas More University College in Antwerp, Belgium, where we had 41 young people, the same age group as the young venue goers, right? Looking into multiple aspects of what we would do. And one of the things we did is we did measure under headphone what is the difference between their audiogram with and without hearing protection. And we used different kinds of hearing protection. The yellow line is the disposable foam hearing protection. Typically, you get free of charge at a concert. The green line is custom-made hearing protection with music filters. And then the gray lines in between is this kind of typical hearing protection. It's instant fit hearing protection, but most of them had music filters in place. Now, why would you use a music filter? Well, you see that right away, because if you look at the attenuation of the disposable foam hearing protection, you can be happy because it is adding 27 dB attenuation, 32 dB attenuation, and at 8,000 Hertz, even 36. Sounds great, but unfortunately, this is killing the whole sound experience. Because if you really reduce the high frequencies too much, then the enjoyment of music can be gone. And that is why such a music filter will have a flat response at higher frequencies, also the ones in instant fit systems, which hopefully would result in a better sound and music experience. And in the standard, we talk about high fidelity earplugs. So that is both custom made and instant fit, as long as they have music filters in place. And they preserve the high frequencies much better. Okay, what is then the impact on your sound experience, right? The enjoyment of music. That's what we tested as well. So what we did, all those young subjects had to listen to the same music files, all at a fairly high level, so at a fairly loud level, because that would be a reasonable assumption in a concert. So we had the level set to 70 dB SPL at least to really be there, and 75 dB SPL, so at different levels. And then we were looking and we randomized the order of the hearing protection they should use. And then we see the yellow bar getting a fairly poor score on the sound experience. It was a visual analog scale we used from 11 points. And you see a significant difference with all the other hearing protection, all the instant fit hearing protection, and also here the custom made with music filters. So you see right away that it is correct that foam disposable hearing protection is negative for the sound experience and sound quality, but all the other ones, all the high fidelity earplugs, are doing quite well and are significantly better than that. So that's already a way to solve it. Secondly, what about comfort? And we see about the same story. Of course, they have been using this hearing protection for multiple tests during that study, so that was easy to compare, but we randomized everything, and here again, we see exactly the same order. The poorest result for the foam hearing protection, only 4 on 11-point scale, so that's not that great. The winner here is custom made. Not so surprising because it's sized to your ear canal, but also the instant fits are doing significantly better than the disposable hearing protection. So that's also a way to improve the comfort. And then maybe a side remark, because since we are talking about central auditory processing, what about speech intelligibility and noise? Because we also sometimes hear that people are not using their hearing protection because they are afraid they wouldn't understand anybody. So we did an adaptive speech audiometry in noise. We used the noise level at 70 dB SPL to be sure it's louder than average, which is typically what you would have an experience in that environment. Now the blue bar is the open ear, so unprotected. And here you see all the different sets of hearing protection. We just inverse the scale, so the more you go above, the more negative the signal to noise ratio could be to understand 50%. And there you see there is no difference between the open ear and any of the types of hearing protection, except the custom-made version, where it was slightly better. So the conclusion here is that, well, in fact, you understand at least as good with your protected ears than with the unprotected ears, and slightly even better with the rest. So this is not an argument not to use your hearing protection. Now, when we state that normally venue owners should provide it free of charge, if you want better quality hearing protection, high fidelity, you may need to pay something. Are young people willing to pay something? And here you see that in that survey that, yeah, in fact, you see that these don't really know, but these really insist, yes, we want to pay for it. So that's good. So young people do want to pay for it. And it's also much more sustainable because there's multiple reasons to have your own set of hearing protection at hand, right? And I hope the whole audience here, and that could maybe be an interesting poll, who of you has his own set of hearing protection at hand right now? But maybe if you're sitting at home, that would be different. We should all have it because it will increase our enjoyment of music. It is much more comfortable. You will understand just as well as unprotected in a noisy environment. When you need it, you have it directly at hand, and it's much more sustainable because at the end of a concert, like in Belgium, it's already mandatory today, you see all the waste of unused hearing protection on the ground and in the waste baskets. It is dramatic, and it's a very good investment for your own hearing, so please go and have your own set. Point 5, the quiet zones. Yes, for sure, it's a new feature. It's something we don't see that much in other regulations, but it's a very good idea. You see, of course, the time you spend, the amount of time you spend in such a quiet zone automatically has an impact on your exposure, which is, of course, logical. The more you are in quiet, the less you are in a noisy environment, and your exposure will go down. So this can, in turn, result in a reduced risk of hearing injury. Would young people like to have these safe zones in place? Looking back at the survey, yes, they would, clearly. Here you see that 82% states, yes, I would appreciate having a place within the entertainment venue where I can rest my ears. I think you know the experience. You have somebody, you want to have a quiet talk, you want to rest a little. You don't want that to be in a high level of music all the time. And then the same question, but maybe put in a different way. I do not see the need of having a quiet zone in an entertainment venue. And then again, you see that the majority does not agree with that. So they really want quiet zones in place. And then last point is having good training available. You know that WHO is already a great source of information on safe listening, suggestions, attitudes, and quality. But don't forget, also the staff needs to be trained on how to handle safe listening practices. The audience needs to know. And you could also label a venue to say it's a safe listening environment. This is what's coming from Brussels. They have created this label. It's the Ministry of the Environment that has created that, where you can see that this is a safe listening venue where the sound level will be around 85 dB. So that's what it will be, or it will be higher. If it's higher, they will provide hearing protection and training, so to make it a safe experience. And we hope to see this logo at a lot of venues and events to show it is really safe listening. Now, to conclude, what do we do with our Awake Listening Safe workgroup? Of course, you already know that we want to create a world where nobody's hearing is put in danger due to unsafe listening, but we have multiple subgroups working on that. So on the first objective, the real objective is to change behavior for our target group, young people at multiple stages, at multiple levels. And that is why it is so key and essential to go there. And we have different subgroups. So if you're interested to help us there, please come and join us. The other one is to convince smartphone and headphone manufacturers to implement standards in their products. And there we have joined forces with ITU to achieve that, and many people helping us. The other one is to educate and advocate to governments to really implement all of this in their regulations, to create much more safe listening regulations and to have them in place and to enforce them. And then lastly, inform sound engineers, event organizers, musicians, the music industry, recording companies and others about all the WHO safe listening standards and guidelines. And by the way, one of those specific work groups is also working on creating new information, communicating with esports and video gaming, where Ayrton, that you have just seen, is driving that specific subgroup. Please come and join us because it is important. And don't forget, when we say putting hearing in danger, this includes hearing loss, but also tinnitus, central auditory processing disorders, and much more. So we have all talked about prevention, and I hope it's clear that we want to go there. You also heard that Ayrton was talking about all the awareness we need to create. Maybe one sidestep, please download the Hear WHO app that allows you to test your own functionality on how to understand numbers and noise. It's free and it's really helping us to create more. But you have also maybe heard there is a new handbook from WHO on screening, and that, of course, young children have to be screened, school children have to be screened, but also adults from the age of 50 should have a systematic screening of their hearing. And then lastly, intervention has to be in place, and intervention includes, of course, hearing aids, cochlear implants, other implants, but also includes rehabilitation, re-education, and of course, training and rehabilitation for central auditory processing disorders as well. So thank you so much for your attention. Please help us to create a world where nobody's hearing is put in danger due to unsafe listening. And please come and join our Make Listening Safe LinkedIn group. Hopefully we can post a link in the chat so you can all see it. You're all very welcome, and we hope to support you there. And if you want this handout, I told the organizers I'm very happy to share it with all of you. Thank you for all your attention.
Thank you very much, Mark. That was really incredible. Some really interesting data. So the takeaway message is protect, protect, protect. But of course, we should be aware that we should move forward to protecting our hearing. Thank you very much. I'm now going to give the floor to